Addiction often serves as a coping mechanism for individuals struggling with overwhelming or shameful circumstances that they find difficult to confront directly. This behavior manifests as escapism, where individuals use substances or engage in distracting activities to avoid facing emotional pain or uncomfortable realities. Escapism is a symptom of deeper issues, particularly trauma. Addressing the root causes of addiction requires confronting the underlying sources of pain and distress. When individuals repeatedly find themselves making excuses or emotionally reasoning to avoid facing challenges, it can lead to prolonged periods of procrastination and further escalate into addictive behaviors. For example, conflicts between wanting something but feeling undeserving can perpetuate a cycle of avoidance and escapism. To combat these behaviors, including fear, procrastination, and avoidance triggered by overwhelming situations, preparation and structured planning are key. Developing a game plan and employing holistic approaches to internalize step-by-step execution strategies can help individuals confront challenges methodically. Seeking feedback and support from others can also alleviate feelings of fear and overwhelm, demonstrating strength rather than weakness. Coping. Without proactive strategies to address underlying issues, prolonged escapism can evolve into addiction. Individuals may turn to addictive behaviors as a way to cope with feelings of insecurity or lack of support, often rooted in early experiences of instability or trauma during critical developmental stages. Recognizing these patterns as survival mechanisms linked to imbalances in emotional and physiological responses underscores the importance of holistic approaches to healing. Individuals may exhibit symptoms such as hyperactive or hypoactive behaviors stemming from unbalanced lower chakras and indicating unresolved trauma or instability in various aspects of life. Trauma can lead to complex coping mechanisms, including addiction and escapism, as individuals seek safety and security through familiar, albeit detrimental, behaviors. Understanding these dynamics is crucial for developing effective treatment strategies that integrate trauma-informed care with addiction recovery efforts. Conclusion. In conclusion, overcoming escapism and addiction involves addressing underlying trauma, healing emotional scars, and reframing negative beliefs. By implementing structured approaches and seeking support, individuals can break free from cycles of avoidance and reclaim control over their lives. This journey towards healing not only fosters personal growth, but also unlocks the potential for a fulfilling and resilient future. Refer to the 7-step panacea system to address core addictive patterns and transform the presenting problem. The Diagnostic Standards Manual for DSM-4 of the American Psychiatric Association defines addiction as the continued compulsive use of a substance or compulsive behavior despite adverse health or social consequences. Medical research describes addiction as a disease of the brain because drugs change the brain, they change its structure and how it works. These brain changes can be long-lasting and can lead to many harmful, often self-destructive, behaviors. Nita, 2013. There is a mechanism in our brain commonly referred to as the pleasure center or reward pathway, which consists of pleasure chemicals such as serotonin and dopamine. When activated by certain drugs or behaviors, it overpowers the part of our brain that governs our willpower, judgments, logic, and morality, decreasing activity in the prefrontal cortex. This leads the addict to abandon what he knows is right. We can recognize this pattern when an addicted person has let their character, responsibilities, integrity, and morality slide and take a back seat in order to obtain a high. Even other vital needs such as sleep, food, and proper nourishment can be put off to attain it. When that happens, the hook is set and the addiction takes control. When we satisfy our physical needs and the lusts and appetites of our flesh, it gives us a false sense of a fulfilling life. In time, however, such a soul will unavoidably feel out of control and may become frustrated, dissatisfied, and even suicidal. In time, we begin to feel that the world seems less and less able to deliver up and fulfill our needs, and may begin to compromise our moral integrity by sacrificing others' needs to fulfill our own while justifying or rationalizing our behavior. John Pontius. A person can become addicted, dependent, or compulsively obsessed with numerous things. Some researchers imply that there are similarities between physical addiction to various chemicals, such as alcohol and heroin, and psychological dependence to activities such as compulsive gambling, sex, pornography, work, gaming, running, exercise, shopping, eating disorders, etc. These substances and behaviors will provide only temporary pleasures, chemically induced rewards, and temporary relief, instant gratifications. Some people may not regard their daily dose of sweets or soda pop as an addiction, as with other addictive substances. However, studies have found that the brain reacts similarly to junk food as they do to drugs. Johnson and Kenny, neuroscientists at the Scripps Research Institute in Florida. In fact, refined white sugar is found to be the most addictive among all substances. Refined white sugar changes the profiles of peptides released from the pancreas, in addition to insulin, which results in a sluggish, immune-suppressant, fat-storing mode. Refined carbohydrates like breakfast cereals, waffles, bagels, pretzels, and most other processed foods quickly break down to sugar, increasing your glucose levels and causing insulin resistance, which is the top underlying factor of nearly every chronic disease and condition, including weight gain. According to a report by the American Medical Association, every year, more than 280,000 deaths are associated with overeating and obesity. The major regulator of triglycerides in the diet is not cholesterol or fat, but sugar and refined carbohydrates. In 1950, Dr. John Goffman, a professor of medical physics at the University of California, found that in general, it was the triglyceride level, not cholesterol level, that was most closely linked to heart disease and atherosclerosis. Therefore, the similarities among overeating, obesity, and classical addictions have long been demonstrated. The Food Addiction Institute defines food addiction as a chemical dependence caused by changes in the brain in reaction to the biochemistry of a specific food, several foods, or volume of food. There's a connection between an emotional state and a food substance stimulus. Natural health expert Dr. Joseph Mercola says, many people don't understand that emotional well-being is essential to their physical health. In terms of dieting for weight loss, not addressing emotional issues, whether small or serious traumas from the past, is the primary reason that most people who lose weight often fail at keeping the weight off. Dr. Nora Fokow, director of the National Institute on Drug Abuse, NIDA, made the case that understanding the commonalities between food and drug addictions could offer insights into all types of compulsive behavior. Dr. Fokow went on to describe the common dysfunctions in the areas of the brain involved in pleasure and self-control that are seen in both food and drug addictions. These systems rely on the neurotransmitter dopamine. In both drug addictions and obesity, reductions in the number of dopamine, D2, receptors are common, causing the desire for more. Dopamine is a chemical messenger neurotransmitter in the brain that is linked to the reward system. When people eat highly palatable foods, sweet, salty, and fat, taste buds in the tongue respond by sending signals to the brain reward circuitry. Studies show that these foods dull the dopamine receptors in parts of the brain. This data demonstrates that overconsumption of palatable food triggers addiction-like neuroadaptive responses in brain reward circuits and drives the development of compulsive eating. Common pleasure mechanisms may therefore underlie obesity and drug addiction. This further elucidates that food choices may lead to food as a drug of abuse. These behavior activities may produce beta endorphins in the brain, which produces the high the person feels from the endorphins that are released. Some experts suggest that if a person continues to engage in the activity to achieve this feeling of euphoria, he may get into an addictive pattern that becomes compulsive and habitual. In so doing, he becomes physically addicted to these brain chemicals, thus leading to the continuation of the behavior even though it may have negative social, physiological, and psychological health consequences. The damage done can begin within a few months of starting substance abuse. This is especially true the younger the person is, such as in the case of teens, because their brains are not yet fully developed. When a teen starts using drugs or alcohol, the brain can remain stuck at the maturity level it was at when drug use began. If they stop drug or alcohol use in enough time, before age 25 when the brain is fully developed, there may be sufficient time for the brain to catch up if a healthy lifestyle follows. Unfortunately, few people are able to beat addiction quick enough. So many drug and alcohol users are left permanently stunted, stated Meryl Norton, clinical assistant professor at the University of Georgia. Norton calls this hijacking of the adolescent brain. Since 2004, a 20% increase in suicide rates among teenagers has occurred, with the number increasing annually, and is currently the second leading cause of death among teens. The overwhelming majority of those suicides came about because of addiction in one form or another. Universities report an astounding 250% increase in student requests for mental health counseling. Drug and alcohol abuse affects the ability to learn, plan, make decisions, and lead a responsible or normal life. It also leads to crime because adolescents lose their inhibition against violence. Without the capacity to plan for the future or exercise good judgment, most end up in jails or institutions, or die prematurely. Older addicts are rarer to find because few live beyond 50. Over time, substance abuse not only damages the brain but can cause damage to the heart, liver, and kidneys, claims Dr. Jeff Black, a psychiatrist with Laurelwood at Northeast Georgia Medical Center. Methamphetamine, for example, is well known for causing drastic physical changes in appearance, such as rotting teeth and shallow skin, but also raises body temperature and dehydrates cell membranes, which kills brain cells. Just after 6 months of meth use, the teenager's brain can look very much like the brain of an Alzheimer's patient, explains Norton. Where do addictions come from? What factors affect vulnerability to drug abuse and addiction? Vulnerability is a product of the interaction of a person's biology, environment, comorbidity, and age. In other words, the nature versus nurture theory, or the diathesis stress model, both affect a person's vulnerability. Diathesis refers to a predisposed genetic vulnerability or susceptibility to addiction epigenetics, while stress refers to environmental stressors or triggers that can lead to an addiction. Research from NIDA, Drug Abuse and Addiction, page 12, shows that people generally take drugs to either feel good, i.e., sensation seekers, or those who are enticed by experimenting and risk-taking, or to feel better and avoid pain, i.e., self-medicators or individuals who take drugs in an attempt to cope with difficult problems or situations, including stress, trauma, and symptoms of mental disorders. The apparent etiology of addiction involves an interaction between a substance's reward effects, the individual's biogenetic vulnerability, and modulatory factors such as the presence of pain, stress, and the psychosocial context of use. Heard, 2006. Kahan et al., 2006. The seriousness of addiction disorders should not be underestimated. Many people simply brand addicted persons as defiant, lazy, and irresponsible. This attitude is frequently seen among authority figures such as parents, family members, or teachers of addicted children or teens. Moral and behavioral theorists would argue that in adolescent cases, addictions were initiated by peer and social pressure for the sake of social acceptance or gaining social status, or as a rite of passage into adulthood that impelled addiction. Either of which suggests that moral values and structure systems were not well-founded. Moral decisions are governed by individual values, which are fundamental norms regarding principles, ideals, or standards. However, there are a number of theories on what constitutes morality. For example, there are social theories, cognitive theories, psychoanalytic theories, and personality theories. Addictions frequently develop because of emotional pain from one's past, e.g., abuse, belittling, or criticism, which can lead to perfectionism in the individual, Hagedorn and Moorhead, 2010, or feelings of guilt and shame. In most cases, however, individuals with addictive behaviors either have a biochemical disorder, a history of abuse, or existence of abuse primarily among family members, e.g., psychological, verbal, physical, sexual, or have endured other adverse childhood events, ACE, related to environmental, cultural, social, or other types of extreme stress or trauma. It would be fair to say that addictions are often a response to post-traumatic stress disorder, PTSD, or acute stress, such as the recent loss of a loved one and other tragedies, or subsequent behaviors that developed after the occurrence of trauma like child abuse or molestation. Each of these incidences can socialize youngsters into deviant behavior or cause them to turn to addictive substances as a way to cope or self-medicate. Addiction also has a biogenetic link and is twice as likely if members of the family have used or abused drugs or alcohol. Individuals who have developed strong coping skills to deal with life's pressures have less risk of becoming addicted to drugs. The younger a person is when he begins using drugs, the more likely he is to become addicted. This may be true because younger individuals have not developed the necessary coping skills to deal with life's ups and downs. Stevens and Smith, 2013. Social, behavioral, environmental, and genetic factors then all contribute to the development of drug addiction, while stress often increases the susceptibility to addiction. The etiology of addiction is multifaceted and complex. It remains difficult to distinguish between substance use as a cause of problems or as the consequence of problems because of the many factors involved in addiction. New research and schools of thought are beginning to view addiction with an integrated theoretical approach using a biopsychosocial model. Stevens and Smith, page 82, 2013. As illustrated, multiple factors such as genes, stress relief mechanisms, personality types, and brain reward systems all appear to influence the etiology of substance use and addiction. Some people use downers such as marijuana, alcohol sedatives, or painkillers to calm and medicate hyperactive brain systems. Or some use uppers such as cocaine and methamphetamine to stimulate underactive areas of the brain. Unfortunately, these substances are harmful, addictive, and can cause brain damage, even permanent damage, and are no medication at all. A person suffering from traumatic disorders may engage in disruptive or destructive coping mechanisms, often without being fully aware of the causes of their own actions. Some traumatized individuals may feel permanently damaged when trauma symptoms do not go away and they do not believe their situation will improve. This can leave them with feelings of despair, helplessness, loss of self-esteem, lack of self-love, frequent depression, and feeling anxious if they do not have control over their environment while characteristically having impossible expectations of themselves. This often leads to addictive behaviors. Triggers and cues act as reminders of trauma and cause anxiety, panic attacks, anger, fear, distrust, mood swings, and other associated emotions. Consequently, intense feelings of anger may frequently surface, sometimes in very inappropriate or unexpected situations, as threats or danger may always seem to be lurking, as it was experienced from past events. Self-destructive behaviors will continue until we have sufficiently reframed these traumatic memories and focus on developing healthier coping responses and a healthy relationship with ourselves. The aim is to subjugate these urges and temptations by taking the courage to face the real issue of the pain inside, remedy what is ailing you, and identify what triggers are causing you to reach out for a destructive escape, like addictive drugs. Turning to addiction is nearly always a way to escape in an effort to medicate the hurt or pain that you'd rather avoid or ignore. Have you ever felt an emptiness or void deep inside you? Nearly every addiction or suicide can be traced to a sense of meaningless, worthlessness, or no purpose worth living for. In other words, existential distress. A painful or tragic event merely triggers it. According to the ACM, depression comes from a sense of being deprived of something you want and do not have, but in actuality, you are deprived of nothing, except by your subjective perceptions and decisions. Know that this need not be, and choose otherwise. Just as the 12-step program incorporates, the answer is not in our physical or mental aspects, but found in our spiritual connection. The answer to the problem is not in the same mind it was created in, but in the infinite intelligence of our understanding. Refrain from beliefs about needing drugs or medications and get to the bottom of your true feelings. Because depression is common in individuals with addictive behaviors, it is important to see a professional or get to the bottom of it before things worsen. When treating addiction and addressing past trauma, the awareness of emotions and feelings may have been suppressed or desensitized for years. When finally facing sobriety, the cascade of emotions can come flooding in, and persons may need the help of a professional. It is especially important to address feelings of guilt and shame because these are deep-seated emotions that often reinforce addictive behaviors. To feel good as constant as possible, avoid doing all drugs, legal or illegal. Question any long-term or chronic prescription, or at least take the lowest possible dose required to do the job. Remember that nature has always provided us with answers and natural alternatives. Experience how amazing, responsive and resilient, lively and blissful the natural non-drugged state can be. Being drug-free allows your system to focus on healing your own body-mind rather than compensation for drug-induced alterations that prevent you from experiencing your full range of potential feelings that restore and maintain your natural bliss. Candace Pert, 1997.